Hello friends, welcome to Nursing in Health. Today I will discuss previous year question of JEPBN 2021. First question, ventricular end diastole volume is called option cardiac output, preload, venous return, cardiac cycle. Right answer option B, preload. Cardiac output means total volume of blood pumped by the heart's ventricle in 1 minute. Preload, the stretching of cardiac muscle cell at the end of diastole. Venous return, the rate of blood flow back to the heart's right atrium. Cardiac cycle, series of pressure changes within the heart. It includes atrial and ventricular systole and diastole. Second question, which theory was proposed by Karl Marx? Option socialism, communism, fascism, behaviorism. Right answer option B, communism. কার্ল মার্কস একজন জার্মান ফিলোসফার ছিলেন। কমিউনিজম বলতে একটি রাজনৈতিক এবং অর্থনৈতিক মতাদর্শকে বোঝায়, যার মূল লক্ষ্য এমন একটি শ্রেণীবিন্যাসহীন ও রাষ্ট্রবিহীন সমাজ প্রতিষ্ঠা করা যেখানে সমস্ত সম্পত্তি এবং সম্পদ ব্যক্তিগত মালিকানার পরিবর্তে সমষ্টিগত মালিকানাধীন থাকবে। নেক্সট, photosensitive organ of human eye is made up of option guanosine and retinol, opsin and retinol, opsin and retinal transducing retinins. Right answer option C, opsin and retinal. Next, which is a mechanical vector of human infection? Option mosquito, ticks, sarcina, flies. Right answer option D, flies. Next, furosemide is preferred over hydrochlorothiazide when hypertension is accompanied by bronchial asthma, diabetes mellitus, congestive heart failure, hypercoagulopathy. Right answer option C, congestive heart failure. Next, which is the most important drug in the treatment of organophosphorus poisoning? Prednisolone, atropine sulfate, adrenaline, diazepam. Right answer option B, atropine sulfate. Next, immunity produced by antibody formation during the course of a disease is active natural immunity, passive natural immunity, active artificial immunity, passive artificial immunity. Right answer option A, active natural immunity. Next, BRCA1 is associated with which cancer? Thyroid, lung, breast, leukemia. Right answer option C, breast. Next, the most common form of Down syndrome is trisomy 21, trisomy 19, nucleosome, none of these. Right answer option A, trisomy 21. Next, what is the relationship of sociology with nursing? To provide solution of social problems, to provide total patient care, to enrich human culture, to provide solution of international problem. Right answer option B, to provide total patient care. Next, reduction of pH of blood will reduce the rate of heartbeat, decrease affinity of hemoglobin with oxygen, reduce blood supply to brain, release bicarbonate ion by liver. Right answer option B, decrease affinity of hemoglobin with oxygen. Next, serum level of drug is monitored by a nurse when the patient is on option lithium, diazepam, domperidone, none of these. Right answer option A, lithium. Next, clear vision depend on reflection of light rays, size of pupil and accommodation, refraction of light rays, size of pupils and accommodation, contraction of ciliary muscle and cornea, vitreous body and cornea. Right answer option B, refraction of light rays, size of pupils and accommodation. Next, Mr. Sadhan Vishwas is admitted in the ophthalmic ward with blurring of vision and is diagnosed as a case of glaucoma. Which of the following medication is contraindicated in treatment of glaucoma? Pilocarpine, acetazolamide, atropine sulfate, gelantan. Right answer option C, atropine sulfate. Next, presence of pathogenic bacteria in blood is known as. Right answer option B, septicemia. Next, vomiting center is situated in the hypothalamus, amygdala, pons, medulla. Right answer option D, medulla. Next, a norm is a culture of a society, guideline for socialization, specific guide to action, guideline for social interaction. Right answer option C, specific guide to action. Next, which one is a comparatively poor source of ascorbic acid? Amla, guava, drumstick leaf, amaranth leaf. Right answer option D, amaranth leaf. Next, the accepted ways of doing things together in personal contact. Custom, institution, culture, folkways. Right answer option A, custom. Next, which cell organelle is responsible for hormone production? Centriole, nucleus, mitochondria, Golgi apparatus. Right answer option A, centriole. Next, use of latex gloves during blood collection protect us from accidental needle injury, microtome injury, patient asepsis, body fluid. Right answer option D, body fluids. Next, a drug which is generally administered in standard doses without being needed for dose individualization. Prednisolone, mebendazole, digoxin, insulin. Right answer option B, mebendazole. Next, very low sodium diet is recommended for patient with option congestive cardiac failure, severe edema, hypertension, all of the above. Right answer option D, all the above. Next, the antidotes of morphine sulfate is naloxone hydrochloride, sodium sulfate, calcium hydrochloride, none of the above. Right answer option A, naloxone hydrochloride. Next, cardiac cycle needs how much time to complete? Option 0.06 second, 1.2 second, 0.5 second, 0.8 second. Right answer option D, 0.8 second. Next, hormones that regulate the growth and consistency of size and shape of bones are all except growth hormone, adrenaline, thyroxine, calcitonin. Right answer option B, adrenaline. Next, Mr. Ranjan Sen, a 48 years gentleman, is admitted in ICU with acute chest pain and is diagnosed as a case of anterior wall MI. To relieve his pain, following medication will be administered to Mr. Sen. Right answer option B, morphine sulfate. Next, function of nerve plexus found in layer of alimentary tract is digestion of food, elimination of food, contraction and relaxation of muscle to push the content of the tract forward, to stimulate enzymatic secretion. Right answer option C, contraction and relaxation of muscle to push the content of the tract forward. Next, what precaution a nurse will take while administering injection KCL? It should be administered IV bolus, short IV, fast IV infusion, slow IV infusion. Right answer option D, slow IV infusion. Next, which of the following medicine belong to the group of proton pump inhibitor? Ranitidine, sucralfate, rabiprazole, metoclopramide. রাইট অ্যান্সার অপশান সি, র্যাবিপ্রাজল, এছাড়াও প্যান্টোপ্রাজল। ভিডিওটি ভালো লাগলে অবশ্যই লাইক শেয়ার কমেন্ট করবেন এবং যদি চ্যানেলে নতুন হয়ে থাকেন অবশ্যই চ্যানেলটিকে সাবস্ক্রাইব করে ফলো রাখবেন। ধন্যবাদ।